Assalamu alaikum guys, welcome back. A patient comes to your clinic who has just been operated for cataract surgery and he says, Doctor, my cataract is coming back. The cloudiness or the haziness in the field of vision for which he was operated, now after the operation that is coming back. But that is impossible. How can a person who has just underwent cataract surgery, the artificial IOL is implanted, he has the same cataract like symptoms in his eyes? But the patient on the other hand is not lying as well. Posterior capsular opacification. In this video we are going to discuss about this, and this also we can another name for it is a second cataract or secondary cataract. This is the main cause of the same blurriness or the haziness in the field of vision after a patient has undergone cataract surgery. Before starting the video, I'm going to show you a small video in which I'm going to show you the equipment, the YAG Laser Capsulotomy equipment that is used to treat this, and then we'll proceed. So guys, this equipment or this machine that you just saw, this is known as YAG Laser Capsulotomy, and this is used to treat posterior capsular opacification. So let's first define posterior capsular opacification. In cataract surgery, as we discussed in my previous videos, the lens capsule is left intact. We make an opening in the anterior lens capsule through which an artificial IOL is implanted. Now what happens is that months or years after cataract surgery, in the posterior capsular bag there are lens epithelial cells that proliferate, or we can say if some of the lens material that is left inside intact, that proliferates from time to time, and as a result in the posterior capsular bag you will see opacities being developed. In this image you can see the opacities as seen through a slit lamp, and this again hinders the light, and the light rays cannot pass through it, and then the person will again have the same symptoms like cataract, due to which he will say, Doctor, my cataract is coming back. But it's not cataract, these are basically the posterior capsular opacities that are responsible for this change in vision. Now how to stop them? Well, we cannot stop them. They do develop in almost 50% of the cases over a period of 5 years. But yes, in hydrophobic IOL as compared to hydrophilic IOL, the hydrophobic IOL are shown to have decreased posterior capsular opacities as compared to hydrophilic IOL. Now, these are easily treatable as an outdoor patient in the clinic. It usually takes about 5 to 10 minutes. The doctor will first put dilating drops in the eye so that the pupil is dilated and we can get a clear view of the lens. Then we'll put local anesthetic drops to anesthetize the eye. And through this YAG laser equipment that we showed you earlier, we will make the opacities that can be shown. We will try to make holes in the posterior capsular bag, small you can say small holes, so that these can get dissolved or they can be removed from them. Now they can be broken down by two methods. One you can do a circular capsulotomy, make circular openings in the posterior capsular bag, small openings, so that these opacities can be dissolved, or you can make a cross like pattern so that the capsule opacities they can be withdrawn backwards, and they can like go backward and you could get a clear view. So either you can go circular or you can make a cross-like pattern, so the opacities go behind and the light rays can again pass through easily, and the doctor and the patient can go home on the same day. But we usually give NSAIDs drops and IOP lowering drug for 2 weeks, because this YAG laser can cause an increase in IOP and it can cause inflammation in the eye. So we prescribed these drugs two times a day or 3 times a day. The IOP lowering 2 times a day, the NSAIDs 3 times a day for 2 weeks, and the person will again have no problem. It will be just like he just got operated for cataract surgery. So remember, in YAG laser, the red dot, you have to focus behind the capsule, not in front of not the cornea, not the lens, at the posterior capsule. And remember, if you do not hit the posterior capsule, if you focus on the lens, that can cause in lens pitting. But if you're at the periphery, then you are in safe hands. But if you're in the center, then that lens pitting, if it's a lot, then that can cause problems in vision. So make sure not to do lens pitting or do not hit any other area. The patient cooperation is required in this case. So make sure you hit the opacities in a circular pattern. That's easy, that's how I do as well. Or you can make a cross-like pattern so the opacities can be removed. Do let me know if there are any questions in your mind, if I haven't answered any questions, and if you want me to make topics or any other videos, any other topics that are in your mind, please do comment and I will try to make them in the future. Until my next video guys, take care.